in.
Hi Ashley, my name is Rylie Yoho. I will be performing your full body head to toe physical assessment today. Do you have any questions for me?
No.
Okay, can you state your name and date of birth for me?
Ashley Dixon, 10/29/96.
Okay, and we're just going to start off with a brief health history.
Okay.
What is the main reason for your visit today?
Just a physical checkup.
Physical checkup, okay. And do you have any concerns?
No.
Any questions?
No.
Okay. And what are your health goals for the next year?
I'm trying to lose weight currently.
Oh, wonderful. That's great. And then in the past 2 weeks, have you been bothered by little interest or pleasure in doing things?
No.
Okay. And then are you feeling down, depressed, or hopeless?
No.
Wonderful. That's great to hear. All right. So now I'm just going to ask you some questions about your general health, and then we'll get going with your assessment.
Okay.
Have you had any unexplained weight loss or gain?
No.
Okay. Unexplained fatigue or weakness?
No.
Do you fall asleep during the day when you're sitting?
No.
Okay. What about fever or chills?
No.
Have you noticed any changes in some moles?
No.
Okay. And what about rashes or itching?
No.
Okay. In your breast, have you noticed any lumps? Do you perform any exams at home?
Yes, every month.
Every month on the same day?
Yes.
Wonderful. So you haven't noticed any pain, any lumps,
Nope.
no nipple discharge?
No.
Great. What about nosebleeds?
No.
Trouble swallowing?
No.
Okay. Sore throat or hoarseness?
No.
What about hearing loss or ringing in your ears?
No.
Okay. Change in visions. I see that you wear glasses. Do you wear those constantly?
Yes.
Okay. Are those up-to-date prescription?
Yes.
Okay. What about chest pain or discomfort?
No.
Okay. Do you have a fast or irregular heartbeat?
No.
Okay. Cough or wheeze?
No.
Do you snore?
No.
Altered breathing?
No.
What about shortness of breath when
No.
you exert yourself? Okay, so no shortness
No.
of breath when you walk or run, nothing
No.
like that. Okay. Heartburn or reflux?
Reflex.
Indigestion?
Yes.
Have you noticed any blood or change in your bowel movements?
No.
No constipation?
No.
Okay. Leaking of your urine?
No.
Do you have trouble emptying your bladder?
No.
Have you noticed any blood in your urine?
No.
Okay. When you go to bed at night, do you find yourself frequently getting up to go to the bathroom?
No.
Okay. Have you noticed any discharge?
No.
Do you have any concern with your sexual function?
No.
Are you sexually active?
Yes.
Okay, and do you use contraceptives?
Yes.
What do you use?
Birth control and condoms.
Okay. And how long have you been on your birth control?
5 years.
5 years. Okay, and is it an oral medication? Do you get a
Yes.
shot? Oral med. Okay. Alright, and what about any neck or back pain?
No.
No, okay. Muscle or joint pain?
No.
Are you sensitive to heat or cold?
No.
Okay, and have you noticed any swollen glands?
No.
Any bruising anywhere?
No.
Okay. Have you noticed headache, memory loss, fainting?
No, but I've experienced memory loss before.
Memory loss. Okay, and what brought on your memory loss? Have
A
you had a
concussion.
concussion? Okay. And how did you get that?
A car accident in 2011.
Okay. Were you hospitalized for that incident?
Yes.
For how long?
Just a day.
Okay. What about numbness or tingling in your feet or tips of your fingers? Alright. Do you have an unsteady gait? Do you find yourself falling frequently?
No.
No, you're not clumsy. Do you have any allergies?
To medications, no.
To medications? Environmental allergies then, I'm assuming?
Yes.
Okay. Do you have anxiety, stress, irritability?
Anxiety.
Anxiety. And what, does anything trigger your anxiety, or does it just come on, like, gradually?
It just comes and goes.
Okay. Do you have any sleep problems with that?
I don't sleep.
Why don't you sleep?
I'm in the nursing program.
Oh, that'll do it. So how many hours a night do you think that you sleep?
3 or 4.
3 or 4. That's about average for me as well, which is not good, because you need, like,
8.
I was going to say 6 to 8, but 8, yes. And you're not experiencing any premenstrual symptoms, bloating, cramping, irritability, okay. And then do you have any problems with your menstrual period?
No.
Okay. Do you have hot flashes or night sweats?
No.
Okay, and it looks like you're up to date on your vaccination, so that's wonderful. And then you said for your medications you are on birth control. Anything else?
Ropeneral and Singular.
Is Singular for your allergies,
Yes.
and Ropeneral for your restless leg syndrome?
Mm-hmm.
Okay. So now I'm just going to ask if you have any of this stuff, and you're just going to say quick yes or no, so that way we can just get right through it, get it out of the way, and then we can get on to your assessment. Alcohol or drug abuse?
No.
Allergies? You said environmental.
Mm-hmm.
Anemia?
No.
Anxiety? You said that.
Yes.
You had that. Arthritis, rheumatoid, or osteoarthritis? No. Okay. Bladder or kidney problems?
No.
Blood clotting
No.
in your legs or lungs?
No.
Blood transfusions?
No.
Breast lumps?
No.
Breast cancer?
No.
Any cancer at all?
No.
Okay. Cataract disease?
No.
Chicken pox?
No.
Okay. Did you have the vaccine for that?
Yes.
Wonderful. Coronary artery disease?
No.
Diabetes?
No.
Depression?
Yes.
And you do not currently take anything for your depression?
No.
Okay. What are some of the coping strategies you use for that?
I don't
You don't.
use any.
You don't use any. Okay. Is that something you would like to talk about or discuss with the doctor when he comes in?
Yes.
Here? Okay. I will mark that in your chart, and we will note that. And I will be sure that he gets you. I can get you some information on that, but then he can talk to you about what needs to be done. Diverticulitis?
No.
Emphysema?
No.
Have you ever broken any bones?
No.
Okay. Have you ever had any surgeries?
No.
Great. What about glaucoma?
No.
Okay. Hepatitis B, C, A.
No.
Why did I circle that? High blood pressure?
No.
High cholesterol?
No.
Irritable bowel syndrome?
No.
Okay. Kidney stones?
No.
Liver disease?
No.
Migraines?
Yes.
And what causes your migraines?
Probably stress.
Do they come on suddenly or do they just build up gradually?
They build up gradually. I had one today, and my eyes will get really blurry, and I
Okay.
can see like blurriness.
Okay, so blurriness when you see.
Yes.
Can you describe the pain? Is it aching? Is it sharp? Is it dull?
It's kind of throbbing.
Throbbing. Okay, and what location of your head is that located at?
It's all over.
All over the place? Okay, so no generalized area. Alrighty, and you don't take any medications for your headache? Do you take Tylenol?
Yeah.
Aspirin? Okay. Osteoporosis?
No.
Prostate cancer?
No.
Prostate enlargement?
No.
You're a girl, so I would hope not. Sleep apnea?
No.
Stomach ulcer?
No.
Stroke?
No.
Thyroid
No.
problems? Okay. And you said that you have never had any surgeries, so that's great. Mom, don't come in here. I'm doing my assessment. Oh crap. Stacy, ignore. Okay, so no surgeries. That's wonderful. And now I'm going to ask you some of your family history, and then if any of your mother or your father, brothers or sisters, or your grandparents on either side have had these, just let me know. Alcoholism or drug abuse.
Father and grandfather.
And grandfather. On your mom's side or dad's side?
Dad's.
Alzheimer's disease?
No.
Alzheimer's disease. Okay. Autoimmune disease?
No.
Asthma?
Yes.
Your brother?
Yes.
Bleeding or clotting?
Grandma.
Okay, your mom's mom.
Yep.
Breast cancer, you said all of your aunts have had that?
Mm-hmm.
Ovarian cancer?
No.
No. Okay. Prostate cancer?
No.
Coronary artery disease?
Grandmother.
Okay.
Mom's mom.
Depression, suicide, anxiety?
Grandmother. Mom's mom and my dad.
Okay. Diabetes?
Grandfather. Mom's dad.
Okay. Emphysema?
Grandmother.
Glaucoma?
No.
Heart disease?
Grandmother.
Diabetes? Already
Grandfather.
asked you that. Okay. Hepatitis B or C?
No.
High blood pressure?
Mother and father.
Okay. High cholesterol?
No.
Hip fractures?
No.
Hypothyroidism?
Mother.
Kidney disease?
No.
Okay. Kidney stones?
Mother.
Macular degeneration?
No.
Migraines or headaches?
No.
Osteoporosis?
No.
Okay. So, do you use tobacco?
No.
You smoke? Okay, so you've never smoked. What about alcohol?
No.
Well, that's wonderful because you're underage. I would have to report you. No, just kidding.
Okay.
I would never say that.
I can hear Stacy. You shouldn't. You're underage.
My question would have been unprofessional. Okay, what about sexually? Do you have a boyfriend?
Yes.
Okay, and you guys are obvious. Are you sexually?
Yes.
You should never assume. Are you sexually active?
Yes.
And you said that you use condoms and birth control for that, so that's great. And for your social history, what is your occupation?
I'm a DSP at DD Homes.
Okay. And you said you're a nursing student.
Yes.
Okay, that's a job in itself.
You don't get paid for it.
No, you don't. It's very sad. And your marital status, you said
Single.
single. And but you do have a boyfriend. What is his name?
John.
Okay. And do you guys have any children together?
No.
Okay. So have you ever been pregnant?
No.
Okay.
Dear God, no.
And children are a wonderful thing, but to each their own. And who lives at home with you?
Me and my boyfriend.
You and your boyfriend? Okay. And what are some leisure activities in your free time, if you get free time? I know Christmas break is coming up, so that's a great thing. What will you be doing over Christmas break?
Sleeping.
Oh.
The entire time.
That's great. And hanging out with your friends?
No, probably not. Just sleeping.
Just sleeping. Okay. And so you said you had never been pregnant, and so you've never had any births?
Yes, correct.
Okay. And then what is the date of your last menstrual period? Currently. Okay. And what day did that start? Did it start today or just a few days ago?
A few days ago.
Okay. How old were you when you first started having menstrual cycles?
13.
13, okay. And menopause does not seem to be a problem with you right now, I would hope. I would not say that in my interview either. Okay, so now I'm going to get started on your physical assessment. I'm going to first assess your vital signs. Are you experiencing any pain today?
Just you.
Oh, wonderful. I feel the same. I'm first going to take your blood pressure. I'm sorry about that. My watch tends to beep and stuff. So I apologize for that. First, I'm going to get your baseline. So to get your baseline, I am going to put on the blood pressure cuff, and I'm going to pump while I have my index finger on your radial pulse, and when I can't feel a pulse anymore, that will be your baseline, but I'm going to add 30 to it.
Okay.
Okay? Thank you. Wonderful. Okay, so it looks like your baseline is about 160. And I'm going to take your blood pressure in both of your arms, so I'm going to start over here so we can give that arm a break.
Okay.
Okay. Alrighty, let's see, about 122 over 72, so that's good. And let's go over here and please don't. I'm going to go my assessment. Okay, so I'm going to come over here and I'm going to do the exact same thing. Alrighty, it looks to be about 124/72. They're pretty equal in both, so that's great. Alright, now I'm going to take your pulse, and I'm just going to take it for 30 seconds, and I'm going to times it by 2. Alrighty, I got 68 for your pulse, and when I was taking your pulse, I was also taking your respirations, and they were 17, so that's great. Looking for the thermometer. Okay. Is it? Oh, it is. Jesus. Okay, so now I'm going to take your temperature, and I'm going to take it orally. There's a few different ways you can do it. You can take it in your ears tympanically, or rectally, or with your axilla underneath your armpit, but I'm going to take it orally because I only have an oral thermometer on me right now. So I just need you to stick this underneath your tongue and hold it for me. Beep. Alright, looks to be about 98.9, so that's great. I'm going to have you stand up for me. And if you would step on this scale for me, I'm going to get your height and your weight. Okay, looks to be about 130. Ooh, is that
Sorry.
Is that normal? Do your knees pop often?
Yeah.
Oh, goodness. Well, Alright, well, now I'm taking your height. Looks to be about 5'3½".
Okay.
Now if I would have you sit down, please. Thank you, that's great. And I'm actually going to take, I'm not going to say I forgot. And can you put up that sleeve for me too? I'm going to take both of your radial pulses at the same time to make sure that they are equal. Did I not finish my sentence?
No.
Oh. To make sure that they're equal. And they are 2+, which is good. Alright. Now I'm just going to look at your skin. If I could have you push your sleeves back up for me really quick. I'm going to be looking for any lesions, any moles, which I can see you have a few up there on your chest. You have some down here on your arms. I'm going to be testing the temperature with the back of my hands. Your skin is warm, which is great. I don't feel any bumps. I don't see any scars. Do you have any tattoos that I can't see?
Yes, I have one on my leg and one on my back.
Okay, and how long have you had those tattoos?
About 2 years.
About 2 years? Okay, that's great. Do you have any piercings? I see that you have your ears pierced and your nose. Do you have any other piercings?
No.
Okay, that's wonderful. I don't see any bruising. I don't see any swelling, which is good. I'm going to test the turgor in your hand, and it should bounce right back, and it does. That's testing for dehydration. If it tints, that means that you're dehydrated. I'm going to look at your capillary refill, and yours seems to be good. This is testing for circulation in your hands, in your body. And that seems to be great too, so that's great. Your nail shape is normal. So yeah, that's great. Alright, I'm now assessing your head and your neck, so I'm going to palpate your head, and I'm just going to feel for any bumps, any lesions. I'm going to look for any critters or pests. And your seems to be symmetric. I don't feel any bumps. I don't see anything abnormal in your hair. Which is great. Do you dye your hair?
Yes.
I can tell your roots are coming out.
Oh, gee, thanks.
So that's great. I didn't see any masses. Did it hurt? Was it tender or anything when I was feeling around in there? That's great. Your scalp looked normal. I didn't see any pests or critters in there. I'm going to assess your temporal arteries to make sure they are equal. And they are. Now I'm just going to test for some TMJ. So can you open your mouth, your jaw for me and close it? Open it again. Alrighty, you can close it. Wonderful. I don't feel any cracking. I don't hear any popping, so that's great. Your ears are equal with each other, and that's great. Can you smile for me? Wonderful. Your smile's equal. Can you purse your lips for me? Okay, that's gonna hit on myself, but that's alright. And your eyebrows are intact. Can you raise them for me? Thank you. Alright, that's great. Okay, so now I'm going to palpate and palpate your neck and feel if you have any swollen glands. And I don't feel it. Is it tender or anything? That's great. Can you swallow for me? That's great. That's good. I'm going to feel for your carotid artery, your pulse. Great. That's normal. Wonderful. And there was no tenderness or anything?
Nope.
Okay. And now can I have you move your neck for me? We're just going to perform some range of motion. Can you, without moving your shoulders, can you move your ears? Or not your ears, your head so that your ear touches your shoulder? And the other one. And can you look up for me? And look straight ahead. And look down. And can you circle your head? Wonderful. That's great. Okay, now I'm going to do your eyes. Can you raise your eyebrows for me? Okay, and your eyes look symmetric with each other. They're in line. There's no swelling around your eyes. I don't see any bags for you saying that you were tired. That's great. I'm first going to start by assessing your eyes with an ophthalmoscope. We're going to pretend like this is one. This is Matthew's orange. Okay, so if I can have you remove your glasses, thank you. And I'm just going to be looking at the retina. Wonderful. Now I'm going to come over to this side. That's great. That's great. Alright, now I'm going to be testing for PERLA, which is pupils are equal, round, reactive to light, and accommodation. Okay. So I'm going to first be shining a light just across both of your eyes. I'm going to do one at a time, of course. So if I could just have you look straight ahead. Wonderful. That's great. I'm sorry, my pen light's not functioning, so you're doing a good job, though. Alright, great. And now, if I'm just going to test you for accommodation, I need you to look at this clock behind me and focus on the clock. Now focus on my pen light. Wonderful. Okay, now stare at my pen light. Great, that's great. And now I'm going to have you look at my Schnellen chart that I have going on, and I need you, if you could stand up for me. Thank you. Alright, I'm going to have you occlude one of your eyes and start at the top line and read as far down as you can go.
E, A, B, C, D, F, G.
Wonderful. Okay, that's great. Now I'll occlude the next eye and do the exact same thing for me.
E, A, B, C, D.
Wonderful. Great. Okay, now you can sit back down for me. Alright, I'm going to be performing a test where we're both going to cover our eyes, and I'm going to move my fingers, testing for your peripheral vision.
Okay.
Okay?
I can see it.
You can see it? Okay, yeah, just tell me when you can see it.
I can see it.
Okay.
I can see it.
Oh, I'm doing it the wrong way. That's why you can see it. Ignore me.
I can see it.
Okay.
Okay. Okay.
Okay, now let's do it with the next eye.
Okay. Okay. Okay.
Okay, that is wonderful. And like we already talked about your glasses, your prescriptions are up to date.
Yes.
That's wonderful. Alright, now I'm going to be looking at your nose. Your nose seems to be in line. I don't see any bumping. It's not crooked or anything, so I'm going to assume that you have never broken it. Have you ever broken your nose? No. Okay. I'm going to have you occlude one of your nostrils and breathe in for me. And do it with the next one. Thank you. Wonderful. All right, and now I'm going to be looking up. I'm going to be looking up your ears to be looking to see that your mucus. I would not do that. Your membranes inside are moist and pink and intact and everything. Yep. Okay, they seem to be normal, which is great. And now I'm gonna have you close your eyes, and I'm gonna have you smell a couple different things for me. And once you smell it, just tell me what you smell.
Coffee.
Wonderful.
Shoe.
A shoe, a cute little baby shoe.
Garlic.
Garlic. Okay, wonderful. You can open your eyes for me. Thank you. That was great. Do you have any problems smelling?
No.
No, you can usually smell. That's great. All right, now we're going to do the ears. So first I'm going to take my otoscope here, and I'm going to look into your ears. So if you could move your hair back for me, that would be great. All right.
Oh my god.
Wonderful. Have you noticed any changing in your hearing?
Well, you just yelled. But no.
I apologize. I did not yell in your ear. I was walking away when I was talking to you. Try to get me a bad grade. Okay. So you haven't noticed any changing?
No.
Okay. I can see, I'm going to touch your ear. I can see that your earlobe is, in fact, it's not attached to your head. Okay. And I don't see any bumps. I don't see any scarring. I do see that you have your ears pierced, which is something that we talked about earlier. Is it tender or anything? Great.
Because I'm all on one.
Well, I would have observed that, but you didn't let me get there.
I'm just telling you.
Oh, wonderful. Well, I see a mole in one, so that's great. We're actually going to perform an activity, so if I could have you stand up for me. It's called the whisper test, so I'm going to stand at 3 different locations, and I'm going to have you rub your trachea for me, and I will whisper stuff to you.
Okay. Stacy. This video is the best.
Alright, now I'm going to go over here to this side for you.
We deserve.
Why not I be over here?
An A.
Wonderful, that's great. Okay, now you can sit back down for me. And we're going to perform one more activity. This is my tuning fork I got here. I'm going to hit it off the palm of my hand, and you should feel it vibrating, and you should hear it longer than you can feel it vibrating, okay? So when you can hear it, let me know, and when it stops vibrating, let me know, okay?
Okay. I can hear it and feel it.
And you can feel it? Okay,
Yes.
Is it still ringing?
Yes.
Is it vibrating still?
No.
Okay, wonderful. Now I'm going to come over here to this side.
I can hear it.
Can
I can feel it.
Okay, is it vibrating anymore?
No.
Okay, wonderful. That's great. Wonderful. Okay, so now I'm going to move to your lips. This is when I would ask you to purse your lips for me. Wonderful. Can you smile for me? Okay, great. And I'm actually going to be looking into your mouth. Is this what we used for a thermometer? Mm-hmm. Okay, we're going to pretend. Alright, so I'm going to be looking into your mouth right now. I'm just going to be looking to make sure you don't have any chipped teeth, no lesions, no bumps. Can you have you go ah for me? Alright, wonderful. That is great. Now, can you move your tongue back and forth for me? Wonderful, great. Do you ever have any problems with your mouth?
No.
Any problems? Like no problems swallowing, no
No.
problems chewing?
No.
Okay, great. The color was pink and moist, which is great. That's what we want. We don't want it to be dry or cracked. We don't want any cuts in there. Your teeth are straight and white, so that's great. Awesome. I know. Alright, now I'm going to move to your extremities. So I'm going to first start with your shoulders. Can you can shrug your shoulders for me? Great. Can you do it again? Awesome. That's wonderful. Now I'm going to have you stand up. And we're going to perform some range of motion with your arms. Can you straighten your arms out for me and bring them back to your body for me? Alright, can you extend them. Wonderful. And bring them back down. What about bringing them all the way up? All the way back down. And now can you move them in a circular motion for me? I'm sorry. Excuse this office. It's under reconstruction. Alright, that's wonderful. Okay, and do you feel any tenderness or anything in your arms?
No.
Okay, wonderful. You can sit back down for me. I'm going to do your reflexes now. I'm going to start with your arms. So, just hinge your arm out there for me, yep. Great, wonderful. Now bring it down straight for me. Great. We're just going to do the same thing over here. Great. Now bring your arm down. I keep saying great. I'm going to be that annoying nurse. Alright, any tenderness, any problems doing that? Great. Wonderful. Okay, so now we're going to move to your hands. If you just have them like that, and then flip them back over. This is supination and pronation. And now can you flex and extend your fingers? Great. And now can you do opposition with your fingers? I would have gotten there. Alright, now with your elbows, can you extend them and flex them for me? No pain or trouble with this in your joints? Wonderful. Okay, that's great. And now your brachial pulses are up here. I would assess to make sure that those are equal to each other, which is what we want. And your radial ones, which we already did. We did those when we did your vitals. Alright, now I'm going to move to your posterior thorax. I'm going to be assessing lung sounds.
Okay.
So, yep, if you would just turn
Do you want
around.
me this way or do you want me to turn all the way around?
You can turn around for me so that she can see where I have my stethoscope. Can you move your hair for me too? Alright, now when you feel me place the stethoscope, I just want you to take a deep breath for me. Okay? Mm-hmm. Take a deep breath. And another one. Again. Alright, wonderful. Alright, I'm going to be placing my hands on your back, okay?
Mm-hmm.
Down here. And if I could just have you take a deep breath for me. Okay, again. Wonderful. Great. Is there any pain or tenderness back here?
No.
Alright, I don't feel any bumps. I don't see any bruising. Alright, wonderful. You can turn back around for me. Alrighty, and now if I could just have you lay down for me. I'm going to be testing your bowel sounds in all 4 of your quadrants. Your bowel sounds are always so messed up. Alright, great. They are active in all 4 of your quadrants. Is there any tenderness or pain down there?
No.
Alrighty. I'm going to have you sit up for me. There we go. Alright, and now I'm going... Oh, darn it. I should have done this first. Swing your legs around for me. Yep, you can sit straight. I'm going to perform H2M.
Okay.
Okay. Okay. This is aortic, pulmonic, Erb's point, tricuspid, and your mitral. Okay. Okay. Ashley. Okay, wonderful. And if I could, you just move on that for me. I'm going to assess your apical pulse, and this will take about a minute. Why did I say that so weird? This will take a minute, so if you can just relax for me, okay?
Okay.
Your boobs are huge.
can hear Stacy.
That's unprofessional.
Rylie.
I know. Stacy, don't work me off for this. Alright, we're going to pretend like it was a minute. And I got 72, so that's wonderful. That's great.
Okay.
I didn't hear any murmurs or brutes. Alright, now I'm going to move down to your legs. I'm going to inspect and palpate them. If I just have you move your pant legs up for me. Okay, I am looking for any edema, which I do not see. Warmth of her legs, which is warm, so that's good. I am not seeing any bruises or feeling any lumps. If she did have edema, I would be pushing down on it to seeing if it bounced back, if it was non-pitting or pitting. And then I'd be counting 1 plus or 2 plus for however long it took to bounce back. I'd be assessing her pulses, which are behind her knee, her popliteal pulses, and those are equal to each other. And then I would be assessing the pulses on top of her feet, her dorsalis pedis pulses, and then the pulses that are on the on the back inside of her feet, her posterior tibialis pulses. Okay. Alright, wonderful. That's great. Are you feeling any pain down there?
No.
No. Okay, wonderful. So I'm going to have you stand up. We're going to do another activity.
Mm-hmm.
Oh. Thank you very much. I'm going to test the reflexes in your knee. So I'm just going to give a little
Little whack.
give a little whack. Okay, ready? Great. I'm going to come over here to this side and do the exact same thing. Wonderful. Great. Now I'm going to have you stand up, and we're going to assess a few things. First, I'm going to have you bend over and touch your toes, because I'm going to assess your spine. All right, wonderful. Thank you. You can stand back up for me. Okay, and now we're just going to do some range of motion. No, we're not at that. I know, I'm afraid I'm going to be standing to that. So first I just want you to extend your leg out in front of you. It doesn't matter which one. Alright, now hyperextend it back to the side. Can you move it in a circular motion? This one's doing your hip. And then let's just repeat it on the same, or on the opposite. Forward, backwards, to the side. Great. And now can you move it in a circular motion? Great. And now can you just lift one up? Alright. And the same with the next one. Alright, now can you touch your heel to your shin? Great. Wonderful. Alright, so no problems there?
Nope.
No pain?
No.
Great. Now I'm just going to have you walk towards me. Normally. Okay, now turn around and walk back. Great, thank you. And now can you walk on your toes towards me? Great, and now can you walk back on your heels?
Well, it's a really small room, okay?
Alright, wonderful. And now we're just going to have you stand in one place. And can you close your eyes for me? Alrighty, and there should be a slight sway. And there was, so that's normal. That's great. And now I'm just going to have you do the fingers to the nose. So if you could move your hands straight out. To the nose. To the nose. And now both of them. Wonderful. That's great. Again. Wonderful. For psycho. Okay. Alright, and now this is something I would have asked earlier, but I forgot. You said that you do perform breast exams once a month on the same day. That's great. And you know how to do those?
Yes.
Okay. The pinwheel or the stripes or in the circular motion? Okay, well, thank you, Ashley. That concludes our head-to-toe full-body physical assessment. And if you have any questions, do you have any questions?
Nope.
Okay, wonderful. Your doctor will be in shortly.
Thank you.
You're welcome.